The American Cancer Society estimates that about 22,000 women will be diagnosed with ovarian cancer this year, and over 13,850 will unfortunately pass away from the disease.
So a few years ago, my mom, because of her age, just was suggested to get a check for ovarian cancer, and she went to get a check, and there appeared to have to be some cells in her body that could possibly cause the cancer, and they suggested her to have like a little surgery, which she had a few months later, and it turned out to help her, and now she's good.
This cause is personal to me because it affected my grandma. When I was in 5th grade, my sister and I were coming home from school, and my mom was sitting in the living room waiting for us, and she sat us down on the couch and told us that my grandma, who we thought was, just a little sick and everything and not feeling too well, ended up having to go to the doctors, and they did a scan, and it showed that there were abnormalities within the scan and that she had ovarian cancer.
So some of the risk factors are never getting pregnant, or as I mentioned before, what my mom had, she just needed to get checked with her age. So 55 or older women are more tend to have ovarian cancer, and they should get it checked.
Some of the risk factors are genetic predispositions. It runs in the family, so if anyone had colon, breast, or rectum cancers. And then some of the ways that you can help prevent ovarian cancer is getting a hysterectomy or other preventative surgeries.
Some of the other signs and symptoms of ovarian cancer are the persistent abdominal and pelvic pain, as well as the urgency to urinate regularly.
It really opened our eyes. Everyone in general has to be very aware and just, take care of their bodies, go in, get scans, get checks and everything, because you never know who it could happen to. It happened to Brittany at such a young age, and it happened to my grandma in her 60s. And in between, you just never know.
There's a 90% 5-year survival rate if you identify and treat the causes in the early stages of getting diagnosed.
Fight like brave!